Hey everybody, Dr. Dan here. Hey, just wanted to take a couple of minutes and talk to you guys about something that we commonly hear from people, newer patients especially that are coming through the office, and they're struggling with what I'm sure a lot of people think about whenever they think about chiropractors, which is lower back pain, pelvic imbalance, maybe some sciatica, like discomfort in the lower part of their body. And they come in and they talk to us and they say, hey, you know what, I've been checked by a chiropractor before, I've been adjusted before. Some people have even gone through entire programs before, or even have been under like regular maintenance care for long periods of time. And they're still struggling with the same things over and over and over again. And a lot of times what we find to be true is that there's a overlooked, like, missing link in a lot of those cases where maybe they are getting adjusted very regularly in the lower spine. They're trying hard to get their pelvis balanced out, but it just continues to be a problem for them. And so what we know though is that the upper cervical part of the spine, the atlas and the axis, the top 1 and 2 bones in your neck, in many cases, actually probably in the majority of the cases, are what actually begin to throw the pelvis off, which puts a lot of stress and strain on the lumbar spine and then ultimately on the nerves and the nervous system that are coming through that area. And unless that upper cervical part of the spine is corrected properly to begin with, then it doesn't really matter what we do with the lower portion of the spine. It's always going to come back out of position. You're never going to get that long-term holding and healing effect that we're really going for here. And I wanted to explain that and how that all works. So if you take a look at these x-rays, these are x-rays of a patient that was dealing with something very similar to that, had been adjusted, had been checked actually relatively regularly. If you look over here to his x-ray, you'll see that there is quite a bit of a curvature off to the left-hand side. If you reference the center of the sacrum down here, which is the tailbone, and the line coming straight up there, you can just see how big of a difference it is side to side. Obviously, that can put a lot of stress on that lower spine, but for whatever reason, that was not able to be corrected in the past. And so we took a whole brand new set of films on him, and we wanted to analyze the upper part of the spine. And what we found was that the upper portion of the cervical spine, the atlas and the axis bone, had shifted off in a very specific direction, causing his head to actually become unlevel and unbalanced, okay? For lack of better terminology, quite honestly, his head was just not on straight, okay? And so what happens is the head gets stuck out of position, and then your body automatically will go into a reflexive action. There's actually a reflex in your body. It's just like any other reflex, just like the patellar reflex. And essentially what happens is this reflex will happen automatically. It's not something that you even know is going on. It's not something that you can control. And what happens is the head gets stuck out of position and your body automatically starts to reflex and says, hey, I cannot walk around with my head like this. I need my eyes to be level. And so what it does is it begins to pull a shoulder up, and then it might pull your hip up, and it'll turn you. It might pull your head in front of your body. It'll do all of these postural deviations to start to try to correct that unbalanced head, that unbalanced upper cervical spine. And it does that so that you can walk from here to wherever you have to go without bumping into things, without being unbalanced, so that you can basically see level. And so with that being said, what happens is, boom, this goes out of position. Your whole body starts to torque and twist and do everything it has to do to get the head back to level. And so, then you walk around like that for 5 years, for 10 years, and you start to get a lot of pressure being built up in the lower portion of the spine because your body has been literally torqued out of position for years and years. And so then, people will go and they'll get physical therapy, or they'll get chiropractic, and the main focus is right down there where all of that pain and that discomfort has built up. But the missing link is that nobody, or very few people, look to the upper part of the spine for the actual correction of the issues that's going on, okay? So if you're dealing with something like that, like if you're dealing with long-term lower back issues, long-term sciatica issues, even like a long-term peripheral organ issues like digestive problems or reflux, things of that nature, where those nerves from that lower portion of the spine go, and you cannot seem to get answers, you may want to find somebody that looks at the upper portion of the spine for the source of the problem that you're having, okay? If you don't know anybody or you're not in our area, please just let us know. I'm happy to hook you up with an upper cervical specific chiropractor so that you can find out if that is actually what's going on with you. So again, hope that was helpful for you guys. Love and appreciate you guys. If you know anybody that we can help, always send them our way. We are happy to help all the people that we love. Thanks. Love you.